Welcome back to my YouTube channel, and today we're going to talk about a recent article that was in the New York Times. I read this on August 24th. I happened to be taking some time off this week, so it definitely caught my eye. And as I took a dive back into the article, I was trying to find out what was new about medication and lifestyle that I haven't been talking about for the past 10 years. And it was funny, when I went to do the tweet on my Twitter account, a tweet was there from 2013. I don't know why it stays on that front page, but when I log into my computer, it's always there. And in 2013, my question was, why aren't we talking about lifestyle and breast cancer risk? Because we have so much science and data to show what we need to be doing lifestyle-wise, but nobody's really doing it. So this article in the New York Times came from a review of an article published in JAMA, the Journal of the American Medical Association, by Dr. Shea and Drs. Tice from the University of California, San Francisco. And their article was entitled, Medications for Primary Prevention of Breast Cancer. So in that article, they talk about the use of two different classes of drugs, aromatase inhibitors and selective estrogen receptor modulators. And we know that the selective estrogen receptor modulators, tamoxifen and raloxifene, have been used widely since 2009, when the NSABP study, which I was actually one of the principal investigators in Pennsylvania, there were many PIs around the country, but we compared tamoxifen and raloxifene in postmenopausal women for breast cancer prevention. And there was about a 48% reduction in breast cancer risk. Tamoxifen for invasive and in situ, raloxifene more so for invasive cancer. But we found out that raloxifene was a good drug for prevention because it was being given to women to actually build bone density. Anyway, the long and the short of it is, tamoxifen and raloxifene have been around for a long time. We use them for prevention very, very often. It wasn't until later in 2011 when we started using aromatase inhibitors also for prevention of breast cancer. And that was one of the times that I popped onto the NBC Nightly News when that news came out, and I got to share that information with the world and meet Lester Holt and some really fun people. Anyway, what was interesting for me in reading this is that there's nothing really new with the medications. We've been using them for a very long time. But one of the things that isn't really brought out very clearly in the articles is why an aromatase inhibitor can help prevent breast cancer, as well as lifestyle modification in preventing breast cancer. So if you have ever end up in my office sitting across from me during a breast cancer consult, the first thing that I talk about is lifestyle modification for risk reduction. And a lot of patients are taken aback because they think we're going to talk first and foremost about how to treat the cancer. But the actual surgical treatment of breast cancer it's important, and I'm going to do a great job at it. But at that moment, I have their attention, and we need to really talk about lifestyle, because how aromatase works. Aromatase is an enzyme that helps the final conversion from testosterone to estrogen, which estrogen can fuel many, many breast cancers that we diagnose, which is why we block the production of estrogen to hopefully stop the division of those cells that have estrogen receptors on the surface. So you can give an aromatase inhibitor for 5 years after cancer to decrease that risk of cancer coming back. But what I try to get across to my patients is that if we don't get rid of that substrate, the extra body fat, the belly fat, the precursors for the testosterone, that estrogen bomb is going to go off later in life. And that's something that in the article, it was interesting because they talked about how we know that well-established lifestyle measures for reducing the chances of breast cancer exist, but a lot of women aren't really given that information by their doctors. And so since people are going to go on the internet to find that information, that's why I'm going to put it out there. Most women don't want to get breast cancer. We know that identifying cancer early is very important, which is why screening mammography on an annual basis for women over the age of 40 is so important. But what they did talk about in this article, which I really liked, are the same things that I talk to each and every one of my patients about when they come in my office and they're diagnosed with cancer. First and foremost if we have extra belly fat, if our body is heavy and we are not actually, kind of what I say at our fighting weight and our BMI is higher than 30, women are at a significantly higher risk for getting cancer again or for getting cancer the first time. So it's recommended that women obtain a BMI of 26 or below. Minimizing alcohol. This is what we call a modifiable risk factor. Most people don't realize that more than one alcoholic beverage per day increases a woman's risk of breast cancer. The actual recommended amount to be at what we consider a safer level would be less than 3 to 5 units. Bad news is 1.5 units of alcohol equals 4 ounces of wine. That's not a lot of alcohol. So that is definitely a modifiable risk factor. Whole food plant-based diet. Avoiding animal protein and dairy. We know that a whole food plant-based diet is healthier for our heart. It also helps control metabolic syndrome and diabetes and hypertension, as far as being able to get us back to a place where our bodies are actually healing. Having the first child born in your teens and 20s, well, for a lot of women in the United States, we're not even thinking about having kids well into our 30s. And this is where our very, push and drive toward, career, we kind of shot ourselves in the foot. I can't go backwards. I had my first child at 29, kind of snuck him in there before I was 30. But it's something for us to really think about as a society and as women as we look to decrease the risk of breast cancer. We also should be breastfeeding for a longer period of time. Most women only breastfeed for a few weeks to a few months. Extending that out to past a year has significant benefits. And then the final one they talked about was the judicious use of hormone replacement therapy. So hormone replacement therapy is often given to mitigate the symptoms of menopause. Menopause is a normal part of life. So what I say to patients are, you've got to be on hormone replacement the shortest period of time to alleviate the symptoms. We know that women that take a combined hormone replacement called progesterone and premature progesterone, or estrogen and progesterone combination, have a higher risk of breast cancer. They don't necessarily have a higher risk of death, but there definitely is a higher risk of breast cancer. And we believe that women that do not have a uterus, so if you have a uterus, you have to take the estrogen and progesterone to protect the uterus from getting cancer if you're taking hormone replacement. If a woman does not have a uterus, then she can take estrogen alone, and that actually has a lower risk of breast cancer. So in patients that don't have a uterus, I'm not nearly as concerned about them taking hormone replacement because they can take it safer. And then something that everybody should recognize across the board with every health issue whatsoever is exercise. You've got to move it or lose it. Your body needs to move, and 2.5 hours of strenuous exercise per week is the minimum recommended to decrease the risk of breast cancer. So all of those factors together are things that we should be learning and teaching women at a young age and practicing it. The drugs, the tamoxifen, the raloxifene, and the aromatase inhibitors, they're great options. A lot of women don't want to take them for prevention. I counsel women when they have an elevated lifetime risk of breast cancer. If their lifetime risk of breast cancer is greater than 20%, I sit them down and talk to them about tamoxifen. I talk to them about aromatase inhibitors. But because every single drug we take has side effects, a lot of women aren't willing to do it. So I think the real answer to prevention in the long term, in addition to the medications being offered to women when it's medically appropriate, is that we kind of take a look at our lifestyle. And there's no better time to do that than now, because we know the lifestyle implications with COVID have certainly kind of brought to light the fact that obesity and diabetes and heart disease and living a less healthy lifestyle increases all-cause mortality. And as a global consciousness, now I think we have to wake up and say, what can we do to decrease our risk individually and collectively on the planet? Have a great day. The link to the articles will be in the YouTube link below, and come back again for my next YouTube talk, which is going to be about what do you do if you do get diagnosed with breast cancer, and what are the questions that you need to ask your providers. Thanks, and have a great day.